So now, hopefully you've watched some of our previous videos. I'm going to talk a little bit about recovery from day 6 to 14 after a Shouldice repair. You've gone through the hard part. You're passed through the most intense recovery period, the most intense pain, and now you're becoming a little bit more active. Your pain is tolerable. You may or may not be taking any over-the-counter pain medication. You probably don't need ice anymore to treat your pain. The amount of swelling that you'll notice after surgery has typically reached its peak. There will be a ridge that will feel like a hard Tootsie Roll underneath the incision. And depending on how large your inguinal hernia was, there may be some hardness in the upper scrotum or all the way down the scrotum, depending on the size of the hernia. That hardness is the normal healing of the body. It will increase slightly over the first couple of weeks, but it's not going to have a dramatic increase from the 6th day to the 14th day after recovery. At this point, hopefully you're driving. If you work a desk job, you should be able to return to work, attend meetings, type on a computer. You should be able to prepare your meals, but please don't lift any super heavy pots, and don't plan on entertaining that first couple of weeks after surgery. At this point, we encourage long leisurely walks, even a couple of miles, depending on your physical activity, even 2, 3, 4 miles is okay, but you want to do it at a leisurely pace. You don't want to go at 3 miles an hour, maybe 2 miles an hour or less. Again, the goal of activity in the first 2 weeks is just to get good blood flow, let your body heal. It is not intended to be exercise because we want those tissues to heal before you stress them out. At this point, by the end of the 2 weeks, some of the bruising is going to start decreasing. A little bit of the swelling will start decreasing. In some patients, the swelling increases. In some, it decreases a lot. In some, it doesn't change at all. In some patients, the bruising will go away completely. In some, it'll still be residual. Either thing is normal because everybody heals at a different pace. If you're still experiencing pain and discomfort, by the end of the 2 weeks, you're not alone. Everybody heals at different paces. As long as at 2 weeks you feel better than you did 5 days after surgery, that's normal for you.